I'm Jeff Oliverio, and let's queer up health. JAMA Pediatrics study refutes claims gender-affirming care harms bone health. A peer-reviewed medical study published in JAMA Pediatrics is directly challenging claims that gender-affirming medical care permanently damages bone health in transgender youth. Researchers analyzing bone mineral density data found that while puberty blockers temporarily pause peak bone density acquisition, the impact is modest. Crucially, the study shows that once youth begin gender-affirming hormone therapy, such as estrogen or testosterone, their bone density trajectories substantially rebound. Medical experts involved in the study emphasize with standard clinical monitoring and basic nutrition, trans youth can safely maintain long-term bone health. Health advocates say the findings provide vital scientific evidence countering restrictive state policies that use bone density concerns as a primary justification for banning youth health care. What I always find fascinating about everybody coming in about trans healthcare for children is the lack of people that are out there worried about healthcare for kids that don't have access to healthcare at all,
Right.
whose bone density might be suffering because they are malnutrition
Right.
in the United States. And there's a wide swath of children who are malnourished on a daily basis, that go to bed hungry, that only get their one meal, and typically it could be at school or at the Boys and Girls Club. And so they're never talking about that and what that does to the health of children. Yeah. But the 0.1% of trans kids that are getting gender-affirming care, what their bone density is going to be like.
It's a red herring.
This is
just meant to stir up, get people upset about things they'll never encounter or have to face themselves.
Right.
And they're just hurting people who do have to deal with it.
This is their fetish. This is just their pet fetish that they just love to go back to. They love to fantasize about it. They love to commiserate about it. They love to think about it and mull it over in their minds a million times. And they just want to make people's lives miserable. And the more that they can do that and the more that they can spread lies, the better for them, because that's what their Jesus would want.
Right. And, the reality is these politicians, this is the Journal of American Medical Association who's saying that. And for politicians to ignore what's coming out of the highest levels in medical research for their own, beliefs, and to negate the experts in the field. It just astounds me that they think they know better.
They have somehow tarnished the credibility of expertise.
Exactly.
How did they manage that?
Yeah.
I mean, with the president signing a presidential order yesterday around vaccinations, again, going against all medical scientific research. And I had to watch a doctor be interviewed on national news yesterday with a straight face to say, my best advice would be to consult with your physician. Like, let me call the White House and be like, do you think I should get my son vaccinated with measles, mumps, and rubella at the same time? President Trump, for all your medical knowledge.
This isn't a new vaccine, for shingles or whatever, which I've also been vaxxed. Thank you.
I've had shingles. Get your vaccine.
I would be vaccinated for split ends. I mean, whatever you got, give it to me.
Right.
But I was born in 1966. And I had the MMR shot. In fact, I wasn't able to enroll in kindergarten until I could prove that I had it.
Me too, and I was born in 1987. You couldn't have it.
So this is so old and proven, and that's why but now that there's a measles outbreak, they're anti-education, they're anti-intellect, they're anti-science, they're anti-health. They're basically anarchists, but somehow they manage to keep all the power and the privilege and prestige.
My only hope is that the pendulum of power swings both ways. Mm-hmm. And right now, it has swung so far to the right that hopefully the election that we're going to see in 3 months will that pendulum will start moving back to the center.
It swings to the right, and then it hits the center, though, and we call that far left.
Yes.
That's what makes me crazy.
Well, I mean, even if it hits the center, it's better than where it is now.
I'll take what we can get.
You know, it's just so far out there that most reasonable people, actually, I should say all reasonable people,
Exactly.
are astounded by the audacity of some of the decisions and some of the proposed laws that are coming out of these people that make absolutely no sense and fly in the face of research and wisdom.
I'm going to just disagree with one little thing that you said.
Okay.
You use the word some, and I'm going to say all the laws and all of the proposals that are coming out. You said some of the proposals,
right?
That they're against some of them. No, I think they're against all of them. Yeah, because there's nothing reasonable that's coming out of this. And I'm sorry I couldn't add more to this conversation. I left my body about 3 or 4 times. I think I blanked out because I just can't believe we're in 2026 after COVID, after all of this. Yeah, I mean, we had children living on iron lungs because they had polio. I mean, in our life, not my lifetime, but maybe in your lifetime, you knew people that, you know, had to deal with polio.
I had a friend that got polio.
And when COVID vaccines came out, did you notice how the problem turned around pretty quickly? But poor Fauci is fighting for his life because he did. I can't stand it. It's just, it makes me crazy.
Well, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.